I just want to update that the Mike, he was in the certification process for the AUSM, and I thought that this is the good one for sharing to the people and community. So that's what I contact Mike, and Mike accepted as well. And same thing for Sara as well. So Sara, he was working in the managing the Caravel Autism Center in Lakeville, and I spoke with multiple times and met in person as well, and she's a good person. So she's also accepted. That's one nice things because both are busy people. Thanks for expecting. I think Mike, you can start yourself. I mean, you can just give your introduction and then start your session. Thanks. I'll be
Yeah.
mute. Thank you.
Thank you so much for having us, Ram and Sarah. It's great to see you. Sarah and I crossed paths at the Autism Society in Minnesota for the last couple of years. So it's nice. It's just one big family at this point. Um, so my name is Mike Pucci. I'm an education specialist at the Autism Society in Minnesota. We are based in St. Paul, but we do work all across the state of Minnesota. We've been around since 1971, so this is our 50th year, 5-0. I have not been around quite so long, but if you do have questions on the organization or different ways that we can support you, we're always looking to develop new partners and new contacts all across the state. So we work in 5 main areas. We work to advocate, educate, support, collaborate, and build community. And I've got a slightly better visual for you here that gives you a little bit of a flavor for where and what we're doing. We do a number of different trainings, which is how Ram and I cross paths. And it could be something like this today, where we're meeting different groups and letting you know kind of what is autism and how is it in the fabric of all of our communities. We've got colleagues who are working with legislators down at the Minnesota State Capitol to make sure that the autistic perspective is upheld in the law. We're doing a lot of different youth programs. That's something that's really exciting for me, and we got going this week in the summer. A lot of different youth programs for young adults, kind of ages 12 and up. We got a pretty robust summer camp program that's also working there as well. And then in-house, which is how Sara kind of ties into all this as well, we have therapists. So I won't steal your thunder, Sara, but I will hopefully set you up to just knock it out of the park here in a little bit. This is me. I have been with the education department of AUSM for the last 2 years. I have been part of the AUSM community for 7 or 8 through their camps department. The most important thing to know about me today is that I myself am not autistic. The term that we use to describe folks that are non-autistic or not neurodivergent is neurotypical. So if you hear me say neurotypical, that's someone who, if you cracked open a science textbook, would say a pattern, a brain's developing at a neurotypical or a relatively standard rate. There are lots of things that we could unpack further today. So if there are any phrases that I mentioned throughout and you're like, we didn't get into that, please reach out to me. I know we don't have a ton of time, so it's going to be a little bit broad, but hopefully something connects with you in your world, and we can continue to have this as an ongoing conversation and not just a one-time step. Alrighty. So before we dive into what autism is specifically, we want to kind of start broadly and understand why are we spending our afternoon here on Saturday talking about autism. These are the prevalence rates from the CDC. I believe this came out in 2020 is the last drop of this information. And per the CDC's studies, 1 in 54 children across the United States were diagnosed on the autism spectrum. We put this, boys are 4 times more common to be diagnosed in red, and we put an asterisk because we do want to unpack it a little bit for y'all. We know that far more is known about how autism presents in boys and young men than we do about girls and young women. Now, we anticipate at the Autism Society of Minnesota that we will see this 4 times more likely rate to kind of plateau, to level off at some point as we continue to have better understandings of how autism impacts young girls, how we can see these signs and these different symptoms that we might notice and say, yep, that's part of that's a member of our wonderful community. Autism affects all racial, ethnic, and socioeconomic groups. We do know that access to services and particularly access to getting a diagnosis is absolutely impacted by these different identifiers. So please keep that in mind. We know that to try and unpack autism from a very intersectional lens today, in 15 minutes is just not tangible. So I will move a little bit swiftly, but please keep these different trends in mind. When we look at Minnesota, it is a general reflection of the national prevalence rates for the most part in some of these different qualifier areas. You'll note a slightly higher prevalence rate, and the study was done in Minnesota, 8-year-olds in, I believe, Hennepin and Ramsey County. If you're interested in learning more about this, please reach out to me and I can provide you resources from the CDC that'll help you unpack this a little bit more. Alrighty, if you remember one thing from today, hopefully you remember lots of things, but if you remember one thing, please remember that when you've met one person with autism, you met one person with autism. Just in the same way that you and I come to this training and this moment in time with a lot of different baggage, a lot of different experiences, a lot of different views on the world, so too does each and every member of the autism community. With this in mind, we are going to talk about some of the general characteristics that folks on the autism spectrum share. But please know that these may present and they may look differently in each and every person. So very, very broadly, what is autism? Autism is a pervasive neurodevelopmental disorder. I remember when I first sat through this training, I was like, that is a big title. So my colleagues at Awesome chunked it out for me a little bit. And when we break it down, it's far more palatable. Pervasive means it affects all aspects of an individual's life. Neuro, a condition of the brain, and developmental means it's lifelong. So individuals are born autistic and they will die autistic. It's really important here to note that autism is not a disease. We are not looking for any cures to autism. We are instead approaching autism from a lens of how can we develop communities and spaces and environments that welcome and that celebrate and that include our autistic colleagues. That means that when we'll talk supports in just a second, but that means implementing different supports and inclusive practices to ensure that everyone has an equal seat at this table. So there are some different criteria that an individual must exhibit deficits in to receive an autism spectrum disorder diagnosis. And this is per the DSM-5, so the 5th iteration of the Diagnostic and Statistical Manual of Mental Disorders. That is a mouthful, so if I mess one of those words up, Sarah, please correct me in a moment. But the first 3 qualifiers, so an individual would have to exhibit deficits in each of these 3. The first one is social emotional reciprocity. So this might look like challenges with communication. This might flesh itself out as challenges with different social interactions. Oftentimes we'll be working with folks, and I know Sara has as well in different therapeutic sense, folks who run into different misunderstandings. They say one thing, they thought it meant something else. And now we've got a bit of a ruffle in between this friendship, and now we're trying to work on maintaining this relationship because there was a misunderstanding somewhere along those ways. That could be a way that different social emotional reciprocity challenges present itself. The second qualifier is challenges or deficits in nonverbal communication. We often jokingly say at the Autism Society of Minnesota, if we could put together some kind of dictionary for nonverbals, for reading nonverbals, it would be the most beneficial tool under the sun. Because how many times, even today, it's tricky on Zoom, but I'm a hand talker. I do a lot of motions with my hands, my shoulders are into it, my face is into it. If you weren't aware of what all these different signs and movements and facial gestures meant, it's a whole different language, right? That's a whole new language to try and understand. Then on top of that, we're trying to figure out some of those conversation reciprocity. Sometimes it's the speed of a conversation. It's moving too quick for us to process some of this information. We can imagine there are a lot of hiccups that may occur here. The third one, you might be piecing these together and say, yeah, it's natural that folks might experience some challenges in navigating relationships if we're having trouble communicating, if we're having trouble understanding what other people are meaning. These things often don't exist in isolation, and they absolutely impact one another. So for an individual to get an autism spectrum disorder diagnosis, they would have to exhibit deficits in each of these 3 qualifiers. They would also have to exhibit deficits in 2 out of the 4 qualifiers here. They could exhibit deficits in all 4 and get the diagnosis, but at least 2 is the important thing to remember. And these additional qualifiers include repetitive movement, speech, or use of objects. This could be stimming. So some of you may have heard of the word stimming, so it might be new to others. Stimming is essentially self-regulatory behaviors, self-stimulatory behaviors. These are things that many people do, but there are socially normative stims. And then there are more traditionally autistic stims that the neurotypical majority say, well, that's not appropriate for these spaces. So if you have somebody in your world who likes to tap their foot a lot, they're sitting in a meeting and they're getting antsy and they're tapping their foot, that's a stim. Some of the more common stims within the autism community include flapping hands. You might see folks rocking back and forth. All of these are behaviors that are meeting a need of an individual. When you get really, really excited, your body responds in a certain way. So too do our colleagues on the autism spectrum, and their stims are a way to show that. When you're getting overwhelmed and your anxiety is getting heightened, you're going to respond a certain way. So too do our colleagues on the autism spectrum. These will look a little bit different than maybe you're used to. We find that when we are in largely autistic spaces, when I myself as a neurotypical, I'm in the minority, whether it's an event, whether it's a classroom, something that we're putting on, these stims are very much universal, and folks are very, very comfortable in understanding that this is how folks behave so that they can engage fully with whatever we're working on. The second qualifier is a reliance on routines, a resistance to change. So this might lend itself to a preference for highly structured activities, utilizing schedules, breaking down large tasks into manageable steps. This also might look like individuals experiencing some challenges with transitions, particularly for some of our younger colleagues, but also many of our colleagues at the Autism Society. Our office is a beautiful example of inclusion put into practice as much as it is an idea, because half of our office identifies as autistic or neurodivergent. And we've got plenty of folks who rely on routines and structure, plenty. So if you are working with perhaps a young person and they are really, really hesitant when you got to shift subjects, when you're introducing something new, that might be an example of somebody who has a high reliance on routines. The third qualifier is highly fixated interests. And we mentioned it's more than a hobby, because many neurotypical folks will have hobbies, will have interests, things that we think about frequently, but maybe not to the nth degree. Our autistic colleagues, if I really liked a sports team, I might know who's on the team this year. Some of my autistic colleagues may know who was on the team for the last 10 years and every position they played and all of their statistics, because that's something that really, really gels well with their brain. They're really, really interested in it, and they're going to want to know everything. This is really useful for you to know if you were ever find yourself in a space. Whenever I'm running a class for the Autism Society and there are some new colleagues that are coming, new participants, I'm going to find a way to figure out what those special interests are. And then I was just speaking with a colleague of mine. We have a young man who's new to some of our programs this week. And I believe his parent or guardian mentioned that he's really, really into this kind of, I think it's a French cartoon or something like that. So I wrote down the name and best believe I'm watching it one episode a night this week, so I can come into our class next week ready to talk about this French TV show, because that's me showing an investment in what this individual cares about. It's also going to help us bridge, you guessed it, some of those conversational challenges that some folks might be experiencing, right? Some of those additional qualifiers. So most times out of that, an individual is going to probably be displaying some kind of that special interest. Might be a shirt. You might say, "What are you thinking about?" And they're going to tell you that. Use that to your advantage when we're considering how can we support these folks. How can we make conversations a little bit more palatable to everyone? The last qualifier is sensory processing issues. This is probably the number one call that we get from different community partners. How can I make my space and place more sensory friendly? Which is absolutely wonderful. But I hope by speaking on each of these different qualifiers that you're clicking a little bit that this is just one piece of that big pie, and that a sensory friendly environment is wonderful and it's applicable, but it's only one of those slices. So everybody's sensory profile is a little bit different, just as yours and mine is. We like to think that our colleagues on the spectrum just have a heightened intensity of some of those reactions. So if it's a little bit cold to you, it might be absolutely freezing. Inversely, if it's a little bit cold to you, perhaps some of our colleagues can't necessarily recognize that they're cold, and they might be a little bit not as sensitive as you or I might be. This is particularly important if we're ever providing support. You got a student who's in Minnesota and they're standing on the bus stop in the middle of January, and they aren't super sensitive to cold and wearing shorts, well, that's got health repercussions, right? So important things to keep in mind as well, not just making our spaces more inclusive, but also a real safety capacity too. Autism doesn't exist in a vacuum. There are a number of different co-occurring conditions. The most important one that I want to uplift here today is anxiety. I just gave a training with a colleague of mine, and she has given me permission to share all of this. But she said she thinks 9.9 out of 10 individuals on the spectrum experience anxiety. She also said that the intensity to which she experiences anxiety is a scale that I am not familiar with. She will start her day at my 5, if it's a 10-point scale. And thus, you can imagine if I'm at a 10 and she's at a 10, her 10 looks a whole lot different. The other thing that I want to uplift here is I always, if we're talking supports, if we're talking trying to contextualize things, I'm always going to put a challenge out there to my fellow neurotypical colleagues to sift through how these different conditions impact you. Hard to talk supports and approaches if we're not working through them ourselves as well. So for me, if I was feeling really, really anxious about this training here, it hits me in 2 different ways. I stop eating, can't eat, whatever, my stomach just shrinks, and I have a really, really difficult time sleeping. So now think you got an important training coming up, you got a big meeting at work, you haven't eaten for a day, and you slept terribly the night before. How does that impact your ability to communicate? How does that impact your ability to listen to your colleagues, to adapt if something gets thrown at you randomly? It has serious repercussions, right? And then if we think that 9.9 out of 10 individuals experience these heightened levels of anxiety, well, then you can imagine engaging with the world around them can be a very strenuous activity. So we're going to talk a little bit about different supports, general approaches. And Sarah, please forgive me if I'm running over. But we're going to talk a couple of general support approaches that you can implement in your world starting today and going forward that hopefully will contribute to reducing those levels of anxiety and allowing folks, you all know the difference when you're feeling a little bit tense, how you interact with folks versus when you're feeling really comfortable in yourself. You're far more naturally engaging, you're willing to listen and enjoy what's in front of you. So one way to continually support our autistic community members is to put in visual supports. The sweet thing about visual supports is you can customize these however you need. The other sweet thing is that most of the world in the last year has started to catch up on the fact that visual supports are really impactful. Whoever has gone to the store in the last year, you have seen those big old dots on the checkout aisle that says stay 6 feet apart. That's a visual tool, right? If you've been to a restroom at a restaurant or a shop or something, and they got that 10 steps to break down how you wash your hand, reminded folks, visual support, right? So the rest of the world's catching on, but we can use visual supports in a number of different ways. If it's a big task and we want to break things down, visual supports might be helpful. If we're introducing something new, right? Some of those resistance to change, introducing a visual tool ahead of time, perhaps a social story or something like that, might be beneficial to reducing some of that anxiety to something new. Lots of ways that you can implement these in your world. So I mentioned that the washing your hand. One that's also worth mentioning is time. Time is a really heady concept. What does 15 minutes feel like? What does 30 minutes feel like? Something like kind of like a timer we've got here. It's a time timer is the official name. Might be useful for some of your folks who perhaps have some of that resistance to change, some of that apprehension around transitions. We don't want to surprise folks, right? Surprise is the enemy of our autistic colleagues. That's a direct quote from one of my buddies who I train with. And so having a visual reminder of, okay, 5 minutes looks this way. And when that happens, we're going to transition to something new. Maybe you pair it with a tool like the one right beneath it, a first, next, then. So first we're going to do, first we're going to finish our breakfast. Next, we're going to wash our dishes. Then we're going to get on the bus and go to school. And we got a timer that helps us let us know when that's coming each time. Lots of ways that you can kind of stagger and implement different visual tools to complement one another and support folks in different ways. Another broad way that doesn't involve any tools, any buying any fidgets, none of that, is adjusting our communication. One of the biggest ones that I want to uplift here is allowing for processing time. because it is the simplest way that you can make your dialogues a little bit more inclusive and accommodating. The example that was given to me by one of my autistic colleagues about what processing time is, she said, if you pull up Google and you type in a question, it's not giving you an answer, so you pull up 10 more Googles and you type in the same question, we all know you're never getting that answer, right? That computer's gonna take forever to load. On the flip side, if you type in your question and you give Google maybe an extra minute, it's gonna kick back the answer, right? That's processing time in a very neurotypical nutshell for you. Processing time is simply allowing folks to run through that mental Google, figuring out what they want to share, how they want to share it, and giving them the time to do so. It's really, really crucial that we allow additional processing time to continue to center the perspectives of our artistic colleagues. Oftentimes, if we're in a rush and we're used to a really quick reciprocity of conversation, really back and forth, we might start filling in thoughts for individuals, right, for the sake of moving a conversation along. Now that's going to be pretty detrimental. It's going to tell folks that their perspectives aren't very important, that they don't matter, that folks are just going to speak over them. When we allow a little bit more processing time, it's a really easy way to center an individual's perspective. There are plenty of topics on this slide that we could spend a day on, but that might be the easiest one that I encourage y'all to take with you when you leave here, because it's just a matter of being a little bit more patient. And that kind of feeds right into this, that we want to continue to offer choices to our autistic colleagues. First and foremost, this is respecting the decision-making and the autonomy, the perspective of an individual. It is allowing, particularly for a lot of our young autistic colleagues, to practice that self-advocacy, right? Speaking up on their behalf, expressing their wants and needs. My colleague, Jillian Nelson, who is our policy resource advocate, will scold me if I don't mention that non-compliance is a social skill. Saying no is a social skill. Allowing our young folks on the spectrum to say no is hugely, hugely, hugely important, because if we teach somebody that they can never say no, and now they find themselves in a group home and a group home staff is maltreating them, right? They can't say no. They've been told, nope, you don't get to say no. So respecting folks' decision comes with respecting when they say no. Now, one caveat here is that offering too many choices can be just as overwhelming. So we like to joke that some of those menus, you go to like a Denny's restaurant and there's like 30 pages of options. What are you doing with 30 pages? Nobody needs that many options at Denny's, but that might be overwhelming. So if you know you're going somewhere where there's going to be a wide variety of options, most places got something on, you Google them on your phone, you can find a menu ahead of time, you can pick 3 or 4 options, you present those 3 or 4 options ahead of time, and that way we're still respecting the decision making, but we're making the approach far more palatable. Lastly, I mentioned sensory challenges or deficits around sensory processing earlier, so I should also mention there are so many different sensory supports under the sun. If it ever gets to the point where you find yourself working with an individual and it's beyond what you feel comfortable with navigating how to get these sensory inputs met, this is where occupational therapists come in. OTs, we got a lot of good OT friends over at the Autism Society. So if you ever find yourself in a spot where you're like, you know, my X, Y, and Z is really having trouble with some of these different inputs, I just don't know what to do, give us a ring and we can hook you up with somebody who can work to continue to center the perspective and those needs of the individual themselves, implementing some supports to get them met. One other thing I'll mention about different sensory considerations, as you're finding different tools and approaches that work for the individuals in your world, building sensory breaks into your schedule is going to be a really, really effective way to make sure that folks are getting the necessary input that they need to stay engaged. We build in bathroom breaks, we build in lunch breaks to get more food. Let's build in a sensory break so folks can stay regulated so they can engage exactly as they please. All right, that was the speediest 101 I've ever given in my life. We have so many different things going on at the Autism Society of Minnesota. We'd love to hear from you. We'd love to engage with you further. AUSM.org is our website. You peruse it as you please. If you ever have questions, I put my email address in the chat, and you can always reach out to me. I'm more than happy to share. All righty, Sarah, I hope I gave you enough time, or at least said.
Oh, yeah. That was wonderful.
Thanks, Mike. Yeah, go ahead, Sara.
Let's see, I'll share my screen. Okay. It said host disabled.
Yeah,
Which is
well,
should I?
Give me 1 second.
yeah, and before jumping to the Sara, just to give me some couple of questions to Mike and that. Mike, I mean, can you give me some idea like the AUSM? What is the support for the parents group? Do you have any resources in the AUSM
Absolutely.
sites?
Yes. Sorry, I was refilling my water bottle.
Yeah.
We have a number of different groups. We call them our support groups. We've been meeting virtually for the last year or so. We hope to get them back in person. The idea is we've created these different support groups for different identifying groups of folks. So for example, we have an LGBTQIA group. We have independent adult group. We have special interest or specific topic groups. So if you're really, really into, that one TV show I was mentioning, you're going to meet some folks who might have similar interests. Inversely, we also have a support group for parents. So if you ever find yourself feeling a little bit isolated and you're like, I need to speak with folks who are in a similar space as me, who have gone through some things like this, it's a really, really useful space and a wonderful tool to tap into a resource of folks who have lived it. Parents are really, really, really creative, and they know better than anybody what their child needs. This is a useful spot for you to find other families and say, hey, these are the things that we're going through. Has anyone experienced this? How did y'all approach it? And pick brains more collaboratively like that. So that's on our website as well. If you want a direct link, you can always email me and I'll hook you up with the right folks on our end.
Awesome.
Okay,
Sharing.
providing.
Oh.
Yes, Sarah, you should be able to share now.
Okay.
Yeah.
That's where I am here. Go into. Not as fluent as I think Mike there is presenting online my slides, but I am super excited to be here. So my name is Sara Pahl. I'm the clinical director at the Lakeville Clinic for Caravel Autism Health. And when Ram asked me to do this, originally I didn't necessarily know that Mike would be presenting, but was so excited to, because prior to my my role of becoming a clinical director at Caravel, I was a mental health therapist at the Autism Society for 7 years. So I not only did some of the education supports as Mike is doing now, but also was engaging in therapy with autistic individuals ranging from 6 years to 60 years old and their families. And prior to that, I was working out in Washington State in numerous capacities as an inclusion teacher. I directed a teen program. I've done a lot of in-home work and kind of just have run the gamut of different services that I've provided, but all kind of with a behavior analytic lens, which you'll hear a little bit more about, is what Caravel does. And so, but the Autism Society is near and dear to my heart, and they truly are the best resource. So when you're looking for information, call them first or go to their website, because they're going to have, if they don't have the actual answer, they're going to have a connection to connect you for. And so when I did, decide to leave the Autism Society, was partially because I wanted to get back into the behavioral world with this wonderful lens that I have been provided through working at the Autism Society, and then my prior experiences working with teens in Washington, and to be able to take that and help apply that information or use that experience that I've had in the ABA world, as we call it, And when I found Caravel, it was their mission statement that really like got me. So number one, it's we change lives, but that we're dedicated to helping develop children, or hopefully people and adolescents and young adults will be part of that phrase at some point, and with autism and related disabilities and their families, to develop skills, create connections, and instill confidence. And truly, I believe this from the founders on down, that they really are dedicated and committed to being the most passionate clinicians and really trying to change the lives of not only the clients and also of their staff too. And so part of that was their values that really got me too. So this advocacy. So they're always kind of trying to advocate and to serve and to have access so that clients have access to the highest quality treatment or intervention. And also the teamwork. So partnering with families, healthcare providers, social service agencies, doing what I'm doing right now, community organizations, schools, just to create a better world, so that it isn't just this isolated treatment or therapy approach that we have, that we are really holistically looking across the community and how can we best serve these individuals. Again, that passion. Clinical commitment. So Caravel's clinical commitment is to be able to provide the most highly personalized, research-based and data-driven intervention. And so that goal is that both behavioral and developmental gains we should see with the population that we're serving by following all of these values. That I think that does happen. Operational excellence, so it's really important, as well as professional development for all the staff members. So it's a constant learning, constant training. And one of the things that I think is really great about Caravel is that they have now they're kind of nationwide across states, and they really use all of the experts that they have across the nation, and from speech and language to occupational therapists to psychologists, to trying to make the best kind of program and staff training that we can have. So the approach is using our treatment philosophy, which is grounded in the behavior analytic world. Also really getting good evaluation and diagnoses. So a comprehensive piece that we can look at. And then from that, then we're gonna make that customized treatment plan. So it's always individualized. Always for that one individual. Again, when you've met one person with autism, you met one person with autism. Even though we're using the science of behavior analysis and there's a lot of evidence to support different procedures or interventions, it really should be all individualized to that person. And then the other fourth part, if you recall in Mike's presentation, one of the biggest differences is that social skills, those social differences. And so we're always incorporating those in that, and applying those skills and working on what does it mean to be social and how can we help you navigate your social world. So again, the treatment philosophy, so a type of intervention you may hear a lot of is called ABA, or Applied Behavior Analysis. And that means basically that we're using the science of behavior to understand what's happening and why. And then also, really we're focusing on how can we reward as a word, or reinforce behaviors that are going to help you navigate your world better. And that is kind of like a really, in a nutshell, broad way to say this, the philosophy. And so what the treatment plans, again, are designed so that we're really targeting a lot of communication. If you think of, again, where Mike was talking about advocacy, the ability just to be able to communicate your wants and needs are going to help you within your life, reduce that stress and frustration. And also how Mike indicated that maybe 9 out of 10 individuals are having significant anxiety or could qualify for anxiety disorder. And we do know that. And so one of the ways that we can really approach and make a treatment plan for an individual by not only just constantly like looking at data and looking at what are those indicators of stress or distress and anxiety, what are those communication goals that are going to help that individual, whether it's a little one that's 2 or 3 or it's a 12-year-old, help them feel happy, relaxed, engaged, and be able to navigate their world and have that kind of freedom and success in interacting around them. So that's part of that overall treatment philosophy that we have going on. Again, evaluation and diagnosis. So within Caravel, we have specialists that are trained to recognize those early signs of autism. And I know since Ram had provided some questions before, I'm going to try to sprinkle in answers to some of them. So I think one of them was an autism screener. So one thing that there's a typical screener that can happen at a developmental pediatrician called the MChat. And we also at Caravel, if you go to our website, have another pediatric screener that you can do online. And that's a helpful tool. There, as for adults, or I think about maybe 16 or 17 years and older, there's something called the RADS. There's a self-screener that somebody could do, and you can find that online. And now I forgot what RADS stands for. Rito something. I don't know, Mike, if you know. But that is another screener that you can use. So, but within Caravel, we have these specialists, and what they do is with the diagnoses, the process would go that they're meeting with the client, they're meeting with parents, there's some direct assessments that happen. And then there's also a lot of talking and like reviewing other medical records, talking with other professionals, and making sure that all of those most important features across the whole individual's life are taken into account so we can make that best individualized treatment plan. One thing we know, so there's the research that has shown is that when their early intervention or early treatment happens, that we see a lot of gains. Again, if you think about probably, the brain is developing, and the more that we get there when the younger an individual is and the more intensive, the more likely you're going to see skills just happen faster. And there has been some research that shows like intensive intervention that changes kind of IQ when it started early and starts intensively at a certain number of hours. So we're looking at that. And of course, always incorporating the social skills is another part of that Caravel approach. So why applied behavior analysis? Because it's evidence-based, and that meaning that there has been a lot of research. A lot of those research are single subjects or single individuals, but what they're shown is that if you do this type of intervention or positively reinforce these types of things, you will see a change in behavior. And then that's been replicated over and over again. And so that's what makes it evidence-based research. So it's one reason why at Caravel, we're going to try to use things that we see that seem to make a difference, that help people change their lives. We also then are able to see, and with that, they've seen behavioral and developmental gains. The idea is that we're trying to, build skills to help that individual not necessarily become neurotypical, as Mike would, that's not the goal. The goal would be, again, to be able to access, navigate, enjoy their environment and their world as independently and as much as they can, as they want to. Also, the using applied behavior analysis, systematically we're working on things to be able to generalize skills in many environments. Of course, that's going to, again, access more reinforcing, access more interactions, more things that that individual wants, and be able to function independently in the world. All of these things we are offering at Caravel. So this therapy or these treatment plans, some of that could be happening in an in-home environment or a center-based. So for instance, like I'm directing a center right now, but then we might have clients that are also working on some of these skills, and some of their treatment plan would be designated for their in-home, and doing things in-home. We also provide psychological diagnostic evaluations. So we have a whole location and clinic for that service. Excuse me, sorry. My mouth is getting a little dry, so I'm going to take a drink. And then we also partnership with pediatric and clinical organizations. So we're really, again, trying to make this holistic piece, coordination of services. And then we are always looking for the most experienced clinicians that we can. This is kind of an ABA graphic just to look at what's different about ABA than potentially, say, a good autism preschool or classroom or in the school district, or maybe a second grade classroom, special education classroom. So that maybe a little bit of the difference for ABA that is that it's going to be highly individualized, and that may still happen in a school program, but probably most likely the data and the progress. So we're really looking at the intensive kind of intervention that is applied. So they're really looking day to day, sometimes hour to hour, minute to minute. What we're doing, is it working or is it not? Is it helping? Is it not? We might be looking at, is this client happy, relaxed, engaged, or are they not? If they're not, then why? And what could we change in the environment to help them be that way? And so that, again, that's looking at, so a lot of things that Mike was talking about too, he was talking about a lot of like antecedent strategies. So being able to look at what strategies are really helpful for this individual. So we know a lot of things about the visuals, but we might not know what type of visual works for this individual. So then we will take that data, try to figure it out, try to help best support that individual be able to transition maybe from the classroom to a bathroom if that's something that is difficult for them. And then when the ABCs are kind of our basic way that we look at the function of a behavior. So that the C is just really what happens in the environment immediately after. So we're always looking at that too. So is that something that reinforces it? Like, maybe if the typical example in the past used to be like, if you're in the grocery store with your kid, whether neurotypical or autistic, and they want the candy and you say no, and they fall down and they're crying or they're having a tantrum, and then you give them the candy, then they might be more likely to have that tantrum the next time. That might be one thing. We might say that reinforced the tantrum if it happens again. Or for instance, if somebody is able to say, give me some space, and then they get space, and that was what they really wanted, then they're more likely to say, give me some space, and get that space in the future. So we're looking at all of those behaviors all the time, and that is really what applied behavior analysis does. We're just kind of looking at the function of the behavior. We're systematically taking the data and breaking things down to small pieces so that it's easier for the individual to learn and be successful with. And at Caravel, again, one of the things that's really important are these team members. So we have the community, that may be the school environment, medical professionals, speech and language, or occupational therapy, as well as parents. And I know that there were a couple questions about parents and stress for parents, and what are things that can help parents. And I think that the support groups at places such as the Autism Society are a wonderful place to go, as well as within typical ABA programs, we provide parent training or guidance or counseling. And what that is to do is to try to help provide parents tools and understanding whether that is some of the behaviors that can be distressing for that individual and for the family, strategies to help decrease some of that anxiety, ways to understand behavior so they don't feel maybe as either helpless or hopeless, or they're able to intervene on their own, as well as create that success across the family, and be able to feel like, hey, I see what's going on, I can do this, I understand my child better. So that's part of the ABA program typically too. And whatever the child is learning, say in a center program, then we would also want to be making sure that the parents are able to experience or work with the child, or be able to use or have those same skills happen at home, because it wouldn't be beneficial necessarily if it was just they were only able to say cookie or use some of their communication in the center if they weren't able to use it at home. So again, it helps generalize the skills. So I think that's one thing that also helps decrease some parents' stress. It's just getting more understanding, more information, and that is part of a typical ABA program and definitely part of the Caravel approach. This was just an example of what it would look like in an early learning program, and that might be the 2 to 4 year olds, somebody that's just coming in. And when we're talking intensive, it's a lot of hours, and that kind of seems really crazy. And yes, it does, but a lot of times what is happening is that really it's a lot of building rapport, a lot of playing, getting as many opportunities as possible to request those favorite things, especially whatever they're interested in, whether that might be piggyback rides or pushes and chairs or spinning a wheel on a car. We're able to work on that and help that individual communicate that need or that want, and then get as many opportunities to do that as possible. Typically, too, we're going to be a little bit more structured, and we're going to use a lot of visuals and a lot of visual tasks. There's going to be this high level of reinforcement, so lots of continual getting things that they love. And then these on the right-hand side would be the example of the goals. So we might say that the individual has a goal of requesting something, or we'll play with new toys, or we'll match puzzles and imitate things, following directions, and then daily living skills. These are all kind of typical programs that we might have in a young early learner program. In the intermediate program, we might reduce some of the structure and try to do more naturalistic things, and we're really looking at school preparation again, where we want to collaborate and be that bridge, because some of our environment can be kind of restrictive in a sense that it's very clinical and it's intensive, and it should really be not long term, it should be short term, and we should be able to bridge that gap to the school and help work with the school. So we're looking at school preparation pieces, and how can we collaborate, again, really thinking about those social skills and conversation, and how can we maybe decode some of those conversation skills and help that individual, or again, learn how to advocate, to say, hey, it takes me a minute, can you give me a second, and then I'll answer you, whatever it may be, to help them be able to navigate easier in their environments. And then we're also looking at more group skills and more imaginative skills, and then also community skills as we get into more an intermediate learning program. And an advanced learning program would be a really flexible structure, trying to get as much teaching in a natural setting, video modeling, a lot of social stuff. So this might be a lot more social skills. This might be also individuals that they are in school during the day, and maybe they're coming to the center or the clinic after school for a couple hours, and then they're working on things like daily living skills, chores, or play, different communication, joining conversation, staying on topic, or being able to say, hey, I'm fascinated by this topic, I know you want to talk about that topic, I want to talk about trains. So, and that's okay. That would be another set of skills that we would be working on within an advanced learning program. So I really wanted to highlight that Caravel is, and one of my personal passions too, is this collaborating and coordinating with the other service providers. So different treatments for autism, there really isn't treatment for autism. There's different experts in different areas. So again, if you notice the differences in the social communication, as Mike was pointing out, so speech and language therapists, they're the experts in speech and language, and they absolutely are a huge, important part of an individual's team. And we want them, we want to be collaborating and consulting with them as much as possible, because we're kind of implementing and working on lots of speech goals all the time. And so getting their expertise and their information is really helpful and really important, as well as occupational therapists. So those are the ones that are going to work a lot on the sensory pieces and the motor movements, or physical therapists. And they can help guide us on what can we do then day to day, even intensively, where they usually are, their service model that usually is once or twice a week for an hour or 2 a week, where we can do, 10 to 20 hours a week. also trying to work, and again, within the schools. I know there were some questions about what does it mean, an autistic individual that's in elementary school or middle school or high school. And so if the individual has qualified for an individual education plan, that should be following them throughout the school years and can follow all the way up until 21. Within that plan, then what the team decides, and the parent is the driver of that team as well as the school staff, but it could also be outside service providers like a speech and language person, or potentially somebody like the ABA provider or Caravel, in the instance of myself, that we would be part of that. And then we would all be looking at what makes the most sense, what's going to help this individual and the individual themselves, by the way. So once in middle school and high school, the student should be part of those IEP meetings and should be contributing as much as possible to what goals and what things they want to be working on. But so an individual, as they go through the school system, should continue to get provided supports until 21. There are also, so along those lines, I know there was another question about is there government aid for autistic individuals, or do they qualify for Social Security? Yes. And if you do have a child or somebody that is diagnosed, one thing I would recommend is to reach out to your county and ask for a Minnesota Choices assessment, because they can come and then they will assess and they will see what kind of supports within the state or within your county that you qualify for. And so there's funding for that information. And so those services like personal care assistance or respite and other pools of money that are there, those can follow that child throughout too until they become an adult. And then there's a separate set of adult supports that happen. So all of these things we're trying to coordinate services with. So another person I may be in contact with is a case manager. So a case manager that came maybe from the county, and there might be, because we've identified, safety, one way to keep this individual safer is probably to get a fence within their backyard, because maybe that we know that they're going to, when there's a loud noise, they like to run outside. Well, we can't stop all loud noises from happening, but when they run outside, there's a street right behind them. So maybe we're working with the case managers to help say, we see this is why an antecedent strategy that would be helpful would be to have a fence to help support and keep their safety in mind. We want to also be as open, and at Caravel, we are kind of an open door with the school piece, so school staff can come out, observe. We want to be coordinating with them as much as possible. I think COVID has been really helpful for this because telehealth has made it much easier to connect with school staff. So we have definitely been, at least in my center, connecting as much as possible with that potential team that individual is going to be working with, or if they are in school part of the time, then we're always talking every couple of weeks and seeing what's going on. I think there was also another question I wanted for teens and what are like teen resources. Again, I think I would refer you to connect with the Autism Society of Minnesota, but that there are there are different types of programs out there, but they're not as many. So one of the things that you've noticed, the Autism Society, they have programs for 12-year-olds on up, because there are more early intervention programs. At Caravel, we will serve people from 18 months to 18 years. Again, that's individualized. In our centers right now, though, roughly, or at least in my center, it's like 2 to 13 years old. So, but we will continue to be trying to expand those supports as there's a need for adolescents and young adults as well. So again, we are hoping that we are coordinating and that we're building those relationships and collaborating with others. It's really important really important to ensure parents are always involved in discussions. And so that if you're with whatever team or whatever intervention or therapy that you may have for your child, that it would be important that you are a part of it and that you are driving that discussion with them. Just the way that we get referrals a lot of times are from pediatricians or birth to 3 programs or just friends and schools. That's how we get referred to. And apologize again, I'm not used to sharing, but half of my screen is covered with this little thing. We like to also connect and coordinate with medical providers. So there's a couple of different reasons why. We're really good at taking data. We love data. We're kind of data geeks and looking at that information. But a lot of individuals get prescribed medication. There is no medication for autism per se. So there is medication that maybe people have said this looks like it changes this behavior. And if that is the case, we want to be as helpful as we can, because we can track that behavior and show when that medication was prescribed or this individual started taking it, did those things that you think are going to change. And this is really important because I know, like, once individuals, or there's research out there to show that autistic kids that were prescribed medication, once they were prescribed medication, they're more likely to be within 5 to 10 years on 2 or 3 different types of medications. And we don't necessarily all know the long-term effects of what some of those medications would do to that developing brain as well. We like to be able to try to help and prepare children for medical procedures. Another big reason we want to coordinate with their pediatricians and or assist during medical visits, because it can be very distressing. Again, they don't, if somebody is sensitive to touch, one of those sensory pieces, or just the doctor's office itself, never really comfortable for most people, or shots, those types of things, that we can help at least develop maybe some strategies to make that a little bit less anxiety provoking. Some of those visuals that Mike showed are really important things to help prepare the individual so it doesn't feel like just a completely unknown thing that's happening. And then we also will provide those updates and reports and either screening forms. We, again, at Caravel, Dr. Lund has developed his screening form for us that we provide to pediatricians in the area to use to help identify if they're seeing things, symptoms or differences in children, so that they can get the support they need as soon as possible. Right now, we are currently providing therapy to over 1,200 clients, and there's over 1,000 employees within Caravel. They've grown pretty significantly in the last 5-10 years, and they really, that dedication to the clinical quality and commitment to being able to provide and change lives is really there. So they're not only from a clinical standpoint, but the whole process, they really are trying to create so that if a family is, needing a diagnosis, that they're able to get that, they're able to have somebody walk them through that process, and that it not be distressing or anxiety provoking, that they're able to do that pretty quickly and efficiently as well. And of course, we're just trying to collaborate. I'm hitting that one home. Some of our partnerships that we have right now, and any questions that are still lingering around, let me know.
Thanks, Sara. That, I think, thank you. Thanks for the presentations. I think I like that the questions, we already covered a couple of things in the slide itself. That's a good approach. I like that. And maybe Mike covered a couple of things, but can you, this is a basic questions people asking, multiple times in our questionnaire as well, that what is causing autism? Like, is there anything, or is there any genetic issues or anything like that? How people, get to know that? So that is the basic questions repeatedly asked in the questionnaire thing. So for your experience, maybe you can explain those one questions.
Yeah,
Or
definitely.
Mike, yeah.
Constantly, and Sarah, if there are things that I forget that you want to toss in, please. I'm constantly reminded by my autistic colleagues that I work with, that I get to spend community with every day, that autism has always been here, that autism has always been in our communities. It's always been part of the diversity of the members of our communities. It's just a different way of a brain developing. It is now, you see, we spoke about those prevalence rates. It's just a better understanding of how it presents itself. So as we're learning more about how autism presents itself, obviously the prevalence rate is going to get higher and higher. You know, if you're looking things up from 20 years ago, you're going to hear about the autism epidemic. It's not an epidemic. It's more of our glasses got a little bit more fine tuned and we figured out this is what we should be looking for. And I think it's going to increase because we're still learning more about what it looks like, particularly in young women and in folks that, to be frank, aren't young white boys. That is who is largely getting diagnosed. So as we learn what autism looks like across different cultures, across different bodies of people broadly, we're going to see, I think, increased prevalence rates. There is no like direct cause of autism. It is simply just a different way of a brain engaging with the world. So we want to make that really clear, because a lot of times when folks hear causes, they immediately jump to treatments.
Yep.
And oftentimes that treatment is where folks are like, we can try and cure something. And autism isn't something to be cured. It is just another aspect of diversity in our community.
Sure. Thank you.
Can I jump in? Ram?
Yes, sir.
There is no relationship between immunization and autism, right? There are lots of parents who have or vaccination hesitancy. One of the reasons often they give is, my previous child developed some behavioral issues, so I'm not going to immunize my next child. So there is absolutely no association or correlation between immunizations and
Right. There has, out of all the there has been no evidence to support that within the research. I think what's been very difficult is a lot of times there seems to be that a change that happens in autistic individuals right around the same time that a lot of vaccinations happen. And it's really difficult because they happen at the same time to, not think that has to be it. But so far, there has not been any evidence to support that vaccinations have caused that. And there was a question too about genetics, I believe, and there is a program, isn't it Is it Sparks, Mike? That is. Oh, you're muted.
Yeah.
I think so. That would probably be an Eric question. My boss, who's the head of the education.
Okay, yeah. So I believe it Sparks. I think it's running through the University of Minnesota, that where individuals that are interested in some of the genetic markers or those pieces, you can get basically like they'll swab you and they'll do whatever analysis and that stuff that they need to do, and then you get that information back. As I am not medically an expert on that, obviously, but that is something that if you're interested in, I think it might be free as well.
Yeah, give us a ring over at Autism if something.
Yeah,
I'm curious, because we can probably link you up with the right folks.
Sure. And just as a general question, like how far that autism research is going on, as you guys knowledge, both of you, I mean, anyone can answer that. What is so far that research for this autism area like?
well, I'm not as up on the neurological research or the DNA, like that piece. I think that behaviorally speaking, I think we are definitely looking a lot more at the different ways to approach intervention, right? Looking at how we can use our science and the technologies that we have, but so to decrease, again, that anxiety, I think hopefully there's a lot more coming up about some of the mental health and the comorbid pieces, because I think that's so important. And, you know, just as we keep learning, we didn't have all that information before, but now we have more information. I think we're getting a lot more information from autistic adults. We didn't have that. So whether that be, you know, research in a way of getting information from them and their experience and what was going on, and, you know, 10, 15, 20 years ago, we didn't have that. And now we do. So that's really helpful.
Sure.
I don't know, Mike, do you have any more?
I would also say that research beyond the like the scientific. So a lot of ours in our work that our colleagues at down at the Capitol are working on are things like employment and research around how folks are able to engage with their community as they please and the different facets of that. And then we tie it into, okay, how can we work with our community institutions to get some of those things leveled up a little bit more. But broadly, that's kind of the avenues. We see a lot of underemployment within the autism community, a lot of a really high unemployment rate. So AUSM is working with a lot of different folks across the state to talk about what do accommodations look like. Folks hear accommodations and they back off real quick. Accommodations, like we talked about, 20 minutes ago, could be allowing for additional processing time, right? Which takes a whole $0 to implement into your environment. So that's another avenue of research that's continuing to grow, is folks being engaged with their communities too. But to Sara's point, we're miles from where we were 10 years ago. And in 10 years as well, we are going to have a really large wealth of knowledge to work from.
Sure. Yeah, and I have one more specific questions which has come from the question as well, like the students who has then neurodiversity, right? So the students is in the college plus the employment, like you touched that employment. So that's what I'm asking, like how the support in the college plus the after college, what is the supports? What do you guys have in your experience like?
Well, in college, I mean, there's the disability office, right? So that you are protected under law that they're able to provide those accommodations. So there are supports. Sometimes they're from having your own room to being able to have a test in a separate location, or wear headphones, or some other accommodations that may be available. So I know that is provided throughout all colleges, and that should follow to the workplace as well. And so in my experience, it depends on what college you go to. Like some are really supportive and really helpful, and others are, it might just be like maybe one small room that they allow you to have those supports. So there's different types of like, whether that's mentoring or coaching or peer supports, I think that can be out there as well. Mike, do you have more to say about?
Just building off of what you were saying, Sara, that we know we call it a service cliff when folks reach 21. So many of their services are tied to an educational institution. So a lot of folks, if they're 18 and they're leaving high school, or they went to a transition program afterwards, they reach that point, and the services available to them seemingly disappear, right? Somehow we think that autism is, once you're out of school, you're no longer autistic, you're good to go. And we know that's not true. So a lot of our programs at the Autism Society in Minnesota work to make sure that folks still have a connection to their autistic community. That is perhaps the most important things we do. Over the last year, the number one call I got is folks feeling socially isolated. So we think, when we know that isn't one in a million, rather that's the majority of our community members, and particularly the majority of our adult community members. So even beyond education, that isolation is a truly impactful thing that we're experiencing at the Autism Society. And so putting on events, we host an event called, I believe it's the Autistic Community Summit. The tagline is "By Autistics for Autistics." So all of our presenters are autistic individuals on subjects that the autism community has said, we need more info. We want to talk about this. So myself and Sara's been part of this community too, so she knows the deal. As neurotypicals, we support whatever needs to happen so that our autistic colleagues can continue to build this really, really rich community and support one another. As we talked about a little bit earlier, folks who have lived through these things, got that experience, they've figured out these really creative ways to navigate these challenging systems. So providing opportunities for folks to share that knowledge has been really, really impactful for us too.
And I would add, I mean, one of the other supports that is out there is the vocational rehabilitation. So, or being able to, you can apply or get assessed, and so you can get a job coach per se again, or everyone's like, they will look at what's going to help you be employed, and that may be a job coach that's with you all the time, or somebody that fades out or helps you just find a job. You know, that those supports and those systems look different across each individual, but that is something that individuals may qualify for. Again, it's hit or miss, and if it's really
Sure.
helpful or not.
Yeah. Thanks for the information.
Mhm.
Maybe the final questions, maybe I can look in that questionnaire here. I think you guys already covered most of the questions. I think one was the vaccination. I think Armugham, sir, he asked us as well.
Can I ask?
Yeah, yes, sir. Go ahead.
Is there a relationship between dietary changes and behavioral changes in children with autism? Lots of parents follow gluten-free diet, dairy-free diet, and all kinds of stuff. Do you have any data to support it really helps?
I think what most of the evidence is supporting that there's a high incidence of GI issues or within the autistic community, and so that we do know when you change the diet for some GI issues, that does help. So the behavior change could be, you know, if you don't feel good and if things are hurting, you're likely to be crankier. You might have behavior that's not as you know, it's more challenging for others. So that might be one piece. There isn't evidence to say by changing a diet, it changes a behavior. Does that make sense? Kind of.
A lot of parents, to some extent, because parents will go to any extent to change child's behavior, even if it is a modest improvement. They are so sometimes parents of children with autism, they get exploited in the community by all kinds of nonsense.
Yeah.
I would say that various types of investigations, they send a hair follicles and they give 10 pages of report, which is exactly identical report to everybody, that you have gastrointestinal dysbiosis, this and that. It doesn't make any, majority of the time. I'm a children's gastroenterologist. I see a lot of children with gastrointestinal problem even after 25 years of taking care. I am not clear in my mind what exactly these children's have different problem compared to the other child. Most children do get constipated. Children also get constipated and other types of gastrointestinal issues. Sometimes they do seem to get
right
by lots of the so-called complementary therapies or naturopathic doctors and other people.
Yeah, and I think that was one thing that is important with us at Caravel, again, that partnering with the parents and the medical providers is to really say, what do you think this change, like, I don't maybe know all the answers and something could really have an impact, but if you really believe in trying this intervention, then what do you think what should we see change? And we can really monitor then those behaviors and was there a change, right? Like, rather than us just kind of subjectively saying, I think so or not. So I have done that in the past. I've gone into medical providers or a naturopath's office with charts, you know, and said, okay, they started the diet here. And, you know, you said that would help screaming or whatever it might be. And then we tried not to make any other changes, and screaming kind of still looks the same. Like, should we continue or not. And then parents can make an informed decision too. But yeah, that is one of the reasons that we like to promote evidence-based interventions. Yeah.
So one of the quote you had said, if you have met one person with autism, you have met one person with autism. I didn't understand what exactly it is trying to say. Is that saying that each individuals with autism is very unique and they have different characteristic? It's not like all children with Down syndrome have typical facial characteristics. Majority of them have certain types of heart disease, certain types of hypothyroidism and other things, whereas autism is very heterogeneous group.
That's
Is that what you're trying to say? They are unique.
Yes. I've had an autistic colleague of mine. He's an adult, and when he is speaking with his autistic colleagues, he encourages each and every one of them to understand and be able to advocate for their own brand of autism, is how he coins it. Because when you know how your autism impacts your ability to navigate the world around you, you can better advocate to get your needs met. So it's exactly what you're saying, that there is no catch-all here. One of my autistic colleagues gave me the visual of the night sky with all the stars. Folks find themselves all across. It's very diverse. It's very broad. We have colleagues I work with daily, and Sara used to work with daily, who are independent. They live on their own. We have colleagues as well who need 24-hour care and service. It is a condition that is very much individualized. And so, to Sara's point and what she's been saying all along, as well as my points, when we can individualize supports, they're going to be the most impactful. And we're kind of preaching to the choir here too, which is nice. But that's to get in that when you've met one person, it's going to look a little bit different from each other.
And do we have any long-term outcome data, like what percentage of children with autism achieve higher education or educational attainment, or you said unemployment rate is higher in individuals with autism? There are very good number of high functioning autism, right? Like Asperger's syndrome and other individuals with autism, they do achieve very high academic levels. Is that true?
Yeah, well, I think that probably depends on which area you're looking for, but there are some long-term, probably some 10 to 15-year followings of even intervention from ABA, or how many, when they were diagnosed here, where are they here? And I think you are and I don't know the exact studies. I can definitely look up some, but there were some good research provided through the Voc Rehab piece, because you can see then who went to college but unemployed, or graduated college but unemployed, or has a high school diploma, started college but dropped out, or those types of outcomes. I know that there's some information there, and that was helping inform the employment supports that may be needed for that transition and college-aged individuals. And then I know that there are some studies that will show different outcomes from individuals that had either intensive ABA intervention versus an eclectic or a hybrid model versus, and I think though that was, I might be wrong, but that was completed around 2017. So I'm not sure what the newest research is, but I can look that up for you as well.
It's also a little tricky because, as Sara alluded to as well, we have so many, at least the number one call that we're getting with the Autism Society is adults who are just getting their diagnosis within the last year or two. So if folks are just now getting the diagnosis and recognizing this is how I've been interacting with the world around them, I also see that those numbers will reflect based on folks receiving those diagnoses. But as a general note, on behalf of the Autism Society of Minnesota, we do accept folks that come to us with a self-diagnosis. that they have read on and they've checked out all these boxes and they say, this fits me. But for whatever reason, they don't have the access to the medical avenues to receive that formal diagnosis. We still welcome them as part of our community and provide resources and supports because we know that those medical barriers, we don't want those to be a restriction for folks engaging with their communities. So to Sarah's point, I think the numbers in the last, probably the last 3-4 years are probably a little bit shifting based on some of those more adults getting diagnosed too.
Yeah, and I did just recall that a lot of the data that they initially took were from individual education plans from school-age children on up. And so if somebody didn't qualify for an individual education plan and somebody on, that maybe would be relate as Asperger's or on, have a lot of vocal and conversational higher IQ, they may not have actually qualified, especially 5-10 years ago. So we don't necessarily have that information and that data to show where, where they are, what happened. But I definitely will look up those to see what the most current research is on some of the outcome studies, because I haven't recently. Any other questions?
So as in mute. Is anybody in the call? Is there any questions? If you guys want to raise, you can ask, free to ask as well.
Mike, you did say the autism is equally common in all ethnic group, but I see as well as heard some media news is saying that autism seems to be much more common in Twin City areas among Somali communities. Is that?
Yes, we are also, we're seeing those same statistics. We believe there is, it's gonna sound like I'm a broken record here and repeating myself, but better recognition of how autism presents itself in different folks and different bodies of people. We know that different cultures have different socialized norms, whatever that is. So for a very Eurocentric understanding of, we put a lot of value on eye contact, or before COVID, handshakes. These are things that are traditionally we put a lot of emphasis on for communication, meaningful communication. Many of our autistic colleagues have said, I could either look at you or I can hear you, but I can't do both. So what would you prefer? Making eye contact and things like that is very uncomfortable. So I think it is a case of, we are learning more and more about how autism presents itself in folks who have lived different cultures outside of that kind of more Eurocentric idea. But it is also rapidly developing. So I don't want to speak too concretely to anything or give you anything super firm, because it does feel like last year we were learning more, and next year we're going to have perhaps a new perspective on it too. So we are, what we're trying to do is maintain a resource for everyone. If you are new to the autism community, if you just received a diagnosis, if you think, this fits my experience with the world around me, we're going to be there for you wherever you are. And as we learn more from these communities and we get some more outreach and we're able to connect with them, hopefully we can continue to broaden that communication and that dialogue with folks all across the Twin Cities and the state too. That's the dream. That's the goal.
So the last question from my side. So what is the important for the psychiatrists in this autism, things like, what is important for the psychiatrist in this? What do you feel there? Yeah.
The psychologist?
Yeah.
What is important to have a psychologist, or?
Yes. For the parents' support, or the kid support, what is the main key role for those? The psychologist role. Is there anything we need to consider that?
Oh, well, there's twofold. So psychologists, typically do that assessment, right? The credential of being able to look at and say, meeting the criteria. There are certain, assessments or tests, evaluations that only psychologists can do. A lot of times this is just for funders, like right? For instance, for most of the funders could diagnose somebody, but Blue Cross Blue Shield, I can't because I'm not a psychologist, but I am a licensed professional mental health counselor. So that's number one. So they can do that IQ testing, the cognitive testing. That's another thing that the psychologist can do. And then I think as they're trained, I mean, they've got training in lots of things, so they could show that picture sometimes when you look at, they can look at like the auditory processing or IQ or just that different pattern, and that information can help you understand then more like, oh, look at if his auditory processing is like this low or here, but visual is up here, and so what does that mean? Well, let's give him more time, or different things like that. So that's an important part, I think, for the evaluation piece, like, and to help with the treatment planning and for most individuals. Then for parent, like, I mean, in mental health, potentially, whether that's a psychologist or a counselor, or a mental health counselor, or even a social worker, I think is really, I mean, important for parents to seek that support, especially if they need it, right? And
Sure.
with individuals like at the Autism Society, the therapist there, that's who they're working with, right? That's who individuals on the spectrum and families themselves, so that they can, they're there, they can understand what your world is and resonate with that. But yeah, those support groups as well. And
Sure.
there are also outpatient services for kids, and that would be something like in Caravel too. I might refer one of my clients, like after a little bit, like, hey, no, you know what, I think you should go to the counseling and consulting and do just outpatient psychotherapy, more talk therapy. Any idea about
Sure. So someone asked.
Yeah, that is another type of intervention that is out there, or like the play therapy, floor therapy, or relationship development intervention, those which is covered by the state in the early intervention, their benefit. And for some, that is an approach that they prefer. For us, it doesn't have the evidence to support it the same way, but I think there's a lot of great, like, usually people that are really good at floor play therapy, they're really good, what I'd say, behavior analysts and shaping good behaviors, but they don't know it. So one of the differences is probably they're not going to be as systematic, taking the data and looking at what progress is happening or what to change and what not to change. We would like the behavior analytic world is shifting quite a bit too, and that where it used to probably look a lot like sitting at a table, a lot of the arrangement is really naturalistic and looks a lot like play or floor therapy now than what it used to. So yeah, does that help? I'm not an expert in that modality per se, but I do know, I mean, it can be something that in the past used to look more pleasant than what old school ABA or sitting at a table discrete trial looked like. But it is an intervention that is out there.
Sure. Yeah, I think I can ask the last question. Does anybody have any questions? I think we are almost the time. Okay, the other questions.
Well, I would say don't assume, again, that individualized, if you've met one person, you've met one person. So just because if they have an autistic diagnosis, that doesn't mean a certain set of skills are there, certain skills are not there, or certain sensitivities there, or certain sensitivities not there. So it's, again, that individualized piece. Mike, do you have?
Yeah, when we continue to approach folks as they are, just as you would meet any of us, we would encourage you to continue to meet our autistic colleagues in the same way. Things to keep in mind, we like to always presume competence. Oftentimes when we hear folks have disabilities, folks can tend to speak down to them. We would encourage you not to do that. We always presume competence, and then we can work in there. Also make one note on kind of just general language too that we've been using lately. We have heard from our colleagues, our autistic colleagues, that they no longer use functioning labels, so high functioning versus low functioning. The thought behind this is that folks who are or who would have been labeled high functioning, oftentimes some of the significant challenges that they experience get overlooked. Inversely, and kind of to Sarah's point, when folks get labeled low functioning, the expectations get thrown out, right? We think they won't achieve anything. And that might be because some folks who would have been labeled low functioning maybe don't necessarily communicate verbally. Perhaps they use ASL, they use different AAC. They still have plenty to contribute to our world. So an alternative that you all might utilize, that we've utilized over at Autism, is we speak in levels of support, because support is a universalized concept. Sara needs support, I need support, Ron needs support, we all do, right? And support lets us customize. So I can meet some of those areas where an individual might experience significant challenges with particular supports. I can then fade back in some of those areas where they have significant strengths and allow for that autonomy and that self-determinant life. So those are a couple tips to keep in mind when working within the ASD community. And thank you again, Ron, for having me there, and I really appreciate it.
Yeah, thank you, Mike and Sara. Thanks for the information. I think as an individual, I learned a lot of things from this session. So it's very useful. And I think the participants also has learned a lot of things. So, I mean, your information is there in the chatting. So whoever there in the participants, maybe you can communicate directly with that phone numbers or the email IDs. So thanks again. Thanks a lot. Thanks for the informations, and maybe we can keep connect again in the same area but a different topic. So hopefully you guys can accept that as well. Just want remaining you again. So thank you. Thanks a lot.
Thank you.
Thanks for participating. Thank you. Bye.
Thanks a lot. It's a very informative session.
Now you open.